So we are both recording and online and live on YouTube, sorry.
So Ingrid, do you think this is a good time to start, or do you think we should wait?
We are 23, so maybe wait a minute if people are still joining.
Okay. Well, maybe I'll slowly get started. Ingrid, would you like to say a few words at all before we start, or should we just get right into it?
I think I'll just say welcome to the webinar and then let you take it from here. Thank you, Michelle.
Okay, great. So welcome everyone to the first OmegaNet webinar of 2022. It's good to see you, and it'll be great to have a discussion with you together. So the idea of the webinar today is twofold. I think mainly to reflect a bit on what we've accomplished with OmegaNet, and also to discuss together how we can respond to an invitation that we received from the Cost Association in terms of submitting a Cost Innovators Grant, which is a type of 1-year extension to cost actions that some cost actions are invited to submit. So I have about 30 slides or so that I thought I would run through in terms of kind of summarizing what we've done in OmegaNet, and also introducing this new grant opportunity and what the structure of the new grant opportunity is. And then we thought we would just open it up widely to a group discussion with all of you on the new grant. And the grant is to be developed with the OmegaNet core group and management committee. So it will be important to get all of your feedback and thoughts on this new grant proposal. So just to give you an idea about what the Cost Innovators Grant is, it's a grant that's designed for cost actions that are ending. And our cost action OmegaNet is ending officially in April of 2022. And the idea is to build bridges between what we've accomplished in the network and marketable applications or different types of societal solutions. The total amount of the grant is 125,000 euros maximum, and the money is to be used for networking tools. So just like in a regular cost action, the money is to be used for meetings, training schools, STSMs, and networking activities. To turn the research network outcomes into some sort of new outcome here. And so to give you an idea, this is basically about the same amount of what 1 year of OmegaNet activities would cost. So this grant duration is only 1 year. And if we are successful, it would begin on November 1st of 2022. The submission deadline, though, is very near. It's February 7th, which is just 3 weeks from now. The submission is by invitation only, so we're happy that OmegaNet was selected to be invited to submit this grant. There's only one proposal per action that can be submitted, and it's submitted by the action chair or vice chair on behalf of the management committee. If the proposal is scored well, there is hearings held at the end of May and beginning of June by invitation to discuss the grant in more detail with COST and with the evaluators. And then the decision is expected by the end of June 2022. The success rate is about 20%, which is not too bad. It's higher than other types of funding mechanisms. But there is no possibility for resubmission, so you only get one chance to submit a grant. So this is the context, and so we'd love everybody to think about this context as we go through the overview of OmegaNet and what we've done, and how can we transform that into a COST Innovators Grant for 1 more year of funding. So how did we end up here? Well, about 10 years ago, when I moved to Barcelona in Spain, there was a lot of activity around European coordination of birth cohort studies. And there were 2 funded projects occurring around that time that had as their focus network building inventories of studies, and developing data sharing and research strategy for birth cohorts in Europe. And so these 2 projects were very successful projects in the birth cohorts research area. And probably some of you on the line here today were involved with those projects. So as part of that work, they developed the birthcohorts.net cohort inventory of birth cohort studies. And the rationale for developing this inventory was several-fold. One of the main reasons to develop the inventory was to raise awareness of the effects of early life environmental exposures on child health. They also wanted to stimulate new research in birth cohorts, and also provide information about the cohort studies in a widely accessible manner, accessible not only to researchers, but also to policymakers and stakeholders. And this inventory is still active and available online. And I invite you to check out this inventory. And so 10 years ago, in 2012, this paper was published from the birth cohorts inventory, summarizing the 37 cohort studies that were in that inventory. They came from 19 European countries, and this paper summarized the study design and basic information captured in the birth cohorts. And it's interesting to note here that many of those studies did capture some occupational information as well. So this paper and these efforts were really important in terms of serving as a starting point for building infrastructure for the long-term coordination and collaboration of birth cohorts to ultimately lead to more conclusive studies in the field. And so building on this, successful collaboration of birth cohorts, we also noted that there was a great possibility and a great need and a great potential for more initiatives in terms of coordination and harmonization of European occupational cohort studies. And so with Ingrid and with many of you here on the line today, began to think about how could this be performed in the occupational area. And so how could we increase coordination of European occupational cohort studies to also lead to more definitive and more conclusive research in the field? And so we were very happy that in 2017, our proposal for OmegaNet was accepted by the COST Association. And sadly, our OmegaNet cost action will end in April of 2022, so just in 3 months. And throughout the 4 or 5 years of this network, we had aimed to better coordinate occupational cohort studies, to enhance the scientific output of these cohort studies, and also stimulate new research on occupation and health. So just as the birth cohort started with network building, inventories, and data sharing, so have we started along the same lines in the European occupational cohort area. And so what is a cost action? So I think most people on the line here today know that cost actions are networks. They're run from bottom-up networks. And they are focused around supporting networking tools, such as bringing people together, either in person or virtually, for meetings, for workshops, for training schools, and also for research exchange visits. And that cost actions are open and that anybody can join an ongoing cost action. And they're based on two main principles of excellence and inclusiveness. So COST is focused on spreading excellence in science across Europe, using networking through also increasing access to funding and infrastructure, and with a strong emphasis on being inclusive and having participation in a very fair and balanced manner according to European geography, according to career stage, so also supporting early career researchers in the cost action, as well as having a very clear and fair gender balance as well. And these aspects are monitored very carefully by COST throughout the action. And so why do they do this? So I always find this graph really striking to look at. And so this graph shows you the amount of funding by European country and by European region for health and biomedical research. You can see the yellow bars are the total EU contribution in terms of millions of euros, and the diamonds are the funding rate per million population. So you can see a huge discrepancy here in terms of the funding for biomedical research by European country and by European region. And these different this huge discrepancy in funding is very difficult to overcome the way the current funding structure is set up. And so COST takes a very active initiative using networking as one way to try to overcome this great discrepancy. So these are the activities that cost actions organize. And so many of us here have been involved in different types of meetings and short-term scientific missions and training schools throughout OmegaNet. And so now today we want to focus here on the Cost Innovators Grant, which is another type of tool for cost actions that are coming to an end. And through all these activities, COST ultimately would like to see more approved common projects on interdisciplinary research, more peer-reviewed publications, coordination and harmonization of methods and procedures, and new leadership skills and career advancement for less connected researchers or new researchers in the area, ultimately leading to improvements in scientific impact as well as societal impact. And so here again, you can see how COST defines inclusiveness target countries, and so how they attempt to ensure fair participation by geography. And you can see that they monitor carefully inclusiveness target country participation in cost actions over time. And currently it's about 50% participation in cost actions by inclusiveness target countries. And the country classifications do change over time, and some of the classifications have changed recently. So in OmegaNet, we started with only 23 proposers from 16 countries who submitted the original proposal. And over the few years, we grew about tenfold to over 230 participants from over 40 countries. And this includes 33 European cost countries and cost cooperating states, as well as many other participants from other countries that we either met along the way or knew already and invited to participate, including new participants from near neighbor countries to Europe, international partner countries, and one international organization, IARC. And so the scientific objectives of OmegaNet were twofold. They focused on research coordination as well as on capacity building. So OmegaNet wanted to focus on coordinating and integrating cohorts on occupational health in Europe, implementing different online interactive tools, and facilitating work on harmonization of occupational exposure and outcome information. OmegaNet also focused on capacity building in terms of connecting scientific communities in Europe, providing networking and leadership opportunities for early career investigators, as well as researchers from cost inclusiveness target countries, and provide training in occupational epidemiology and exposure assessment. OmegaNet is organized into 4 main working groups, and then later a 5th task group on COVID-19 was added with the COVID-19 pandemic. And these working groups focused on different aspects of the coordination and harmonization, ranging from inventory of cohort studies and also an inventory of occupational exposure assessment tools, to different types of outputs in terms of consensus definitions, scoping reviews, systematic reviews, or theoretical frameworks on different topics in occupation and health. So some highlights. So what have we achieved in the past 4 years or so? One main output is the occupationalcohorts.net inventory, where currently we have actually closer to 150 cohorts currently registered for more than 30 countries around the world, mainly from Europe, but also from other international countries as well. And we're still working to grow the inventory further and to expand its reach more globally. We also have developed another inventory on occupational exposure tools, ranging from job exposure matrices to coding systems and different aspects of occupational exposure assessment. And then there's been a range of publications on topics of interest to OmegaNet, currently over 20 publications, and I know that many more are currently ongoing and underway and will be completed soon. We've held different meetings, webinars, training courses, and we hope in March to launch another training course, hopefully in person in Barcelona, on occupational epidemiology, this time with a particular focus on non-standard employment or precarious work. So we will be advertising that training course shortly, we hope. And we've also funded over 33 different types of grants in terms of researcher mobility or conference grants for people to attend conferences. And we've also had various seminars at scientific conferences on different topics. And this is the last symposium, that we held at the last EPICO conference a few months ago. So I think a lot of great outputs from all of the working groups and tasks and participants. And I think it's important to say too that nobody received any funding for any of this work, that there's no money to pay for personnel or to pay for any aspect of the research. So I think this is an amazing output from the network. So to give you an idea of where the cohorts come from that are currently registered in the inventory. So here you can see cohorts representing many different countries. You can see a large number of cohorts in the inventory from Australia, from Denmark, Italy, Netherlands, Norway, Sweden, United Kingdom, United States, and several other cohorts have recently been added from other international countries as well. And so if we take a step back to the European birth cohorts coordination and to all the network building and inventory building that they did and data sharing, they eventually, these projects were very successful in stimulating other large scale funding and research projects. And so what they have done since these 2 initial projects was to receive funding for different exposome or non-exposome projects to build central databases of cohort data and to develop a harmonized and a fair data analysis infrastructure. And this has been important in that field. This has been important in that field to really move the field from the initial network building to the conduct of research studies and the conduct of more conclusive research studies. So this is an example from the Life Cycle Project. So here you can see that following the birthcohorts.net inventory of birth cohort studies, what they had also developed afterwards were different tools. One tool is this network variable catalog. So here you can see a screenshot of what that variable catalog looks like. So this is taking the inventory one step further. So whereas the inventory only contains kind of metadata about the general features of the study, this variable catalog shows much more detailed types of information for each variable of interest in each cohort. It provides detailed information on how the variable was defined, the categories of each variable. And then there are harmonization protocols that are developed and published here. And then you can search for the different variables. This is one example for maternal diabetes, for example. And so here you can see these are the different cohort names. And you can see which cohort has this type of information in their cohort. And was this variable harmonized according to the protocol for the study? So the green circles show you the cohorts and the variables where the variable was fully harmonized according to the protocol, and the yellow shows you where the variable was maybe only partially harmonized according to the protocol. So this type of online open variable catalog was an important output of the Life Cycle Project. It's an open access tool, and cohorts can enter their data into the tool. And once the data is harmonized, it can also be uploaded onto a type of decentralized analysis infrastructure using DataShield, where now instead of having to send your cohort data set to another institution or another country, the cohort data can remain on the local server, and a central analysis computer receives only the non-identifying kind of summary analysis results information from the analysis. So it's a nice way to maintain the data at your own local site and your own local computer, but still participate in pooled analysis using data sets from multiple different locations and multiple different countries in a secure way. So these were two of the main developments in the birth cohort area following the initial inventory of studies. So we're hoping to do something similar in the occupational cohort area, and we've started to do this at least somewhat in the Up4 project, which was funded in part arising out of OmegaNet. And the Up4 project was funded from European Exposome funding, and it stands for the Exposome Project for Health and Occupational Research. And so in this project here, which is coordinated by TNO in the Netherlands, there is a work package on pooling European occupational cohorts. This is just one work package out of many work packages. It's a very large project with many different objectives. But here we are attempting to take the next step and moving from the cohort inventory to actually pooling, harmonizing, and analyzing cohort data together. And so the idea here is to pool probably about 30 to 40 cohorts in Europe. Will be the main data will be harmonized and analyzed, representing about 20 million participants or so, using this type of fair data infrastructure. And we plan to do different analyses by job title and by Eurogem exposure on different endpoints listed here. And over the past year, we spent a lot of time inviting the cohorts to participate and meeting with them and discussing with them how we will move forward in this work and what kind of infrastructure we might want to use in this project here. So I think a lot of our time in 2022 and going forward will be on officially implementing the infrastructure closely with all of the cohorts. And so when we think about, where we are now compared to where we were about 4 or 5 years ago, we have learned a lot, I think, and there was a lot of challenges, but also a lot of benefits in the work so far. I can, building these large-scale scientific networks are labor-intensive. There is little funding, including no funding for personnel, and I think that if you take a longer-term view, there are major quantifiable impacts and achievements. But at the same time, there are. I know OmegaNet is mainly a European network, but there are also other funding opportunities for networks of networks in terms of linking European networks with North American networks or networks in other areas. But at the same time, we also need to, I think, balance our efforts, including networking, including efforts in networking and efforts in conducting traditional type of research studies, like we're doing in EMP4. In terms of the rewards, I think everyone involved would say that it's been a very valuable and useful experience, and it's been great to really know all of the different groups in Europe, and that having a formal mechanism for collaboration, even with a small amount of funding, like OmegaNet from the Cost Association, can be very productive. They can be very productive with dedicated commitment from researchers at all levels. And I think there is a lot of value in terms of developing these open and online tools like we have developed with the cohort inventory and with the exposure tool inventory. And I think that it's a lot of value in terms of coordination and developing momentum on scientific issues. And so like we have here, trying to develop a network and trying to develop momentum in the area of occupational cohort studies that has traditionally, especially in the past decade or more, been underfunded. And so what happens after OmegaNet? So OmegaNet, as I said, is officially ending in April of 2022. There is a strong willingness, I think, from many people involved, so that no matter what happens, if we can achieve more funding or not, to somehow maintain and continue OmegaNet, at least informally, following its completion, maintaining the infrastructure that we've already developed and maintaining networking activities together. And we're going to think about that carefully over the next few months. There was also another cost action proposal that was submitted last year on the topic of occupation and health, and there is a decision expected in April, so we're waiting to hear about that. But today we wanted to talk about the Cost Innovators Grant, which is due on February 7th, and it's a great opportunity to also continue the work of OmegaNet, at least for one more year. So I'll briefly introduce the grant and then open it up to discussion from everyone. So what does innovation mean here? And so innovation here is considered very broadly. Innovation can mean a new product, a new process, a new service. It can also mean a new method or a new policy approach, something that's a state-of-the-art change in the area where we are operating. Cost has emphasized that you can propose to a marketable application, but that's not the only thing that you can propose. They're looking for anything, any sort of tool any sort of process, or even just developing a new idea in your field. One step further is a valid type of innovation proposal for them. So what do we need to do over the next few weeks? So we need to put together a draft of a proposal comprised of management committee members and other OmegaNet participants. What's different from a traditional cost application, which are normally required to be anonymous, this Innovators Grant does not need to be anonymous. So here we need to name the persons and name their role in the Innovators Grant. There's no minimum or maximum number of countries or participants that can be included in the grant. And following the submission of the grant, the Cost Association will run a vote of the management committee of OmegaNet, and they are going to request for explicit approval of submission of the grant from the management committee. And 2/3 of the management committee would need to approve the submission of the grant for it to be considered a valid submission. The grant consists of 2 parts. Part A is a brief summary information, things like the title, a summary of the grant, the composition of the team, where the cost action, which cost action the grant originated from. And then part B is the more detailed part of the grant. Luckily, it's only 6 pages here, so that seems manageable in a short amount of time. And there are 3 main parts that we need to put together: one on innovation, one on impact, and one on plan for implementation. And then this is how the grant is evaluated. There are 6 points awarded for innovation potential and impact, and 3 points for implementation. So innovation and impact are important sections here. And you need to reach a threshold of at least 8 points for the grant to be further considered. And so what they're looking for in these 6 pages, so on innovation potential, we need to describe what's the challenge, what's our solution, what are the objectives of our Innovators Grant. We need to describe who will benefit, what is the impact, and the impact needs to be more than a scientific publication. And then in terms of implementation plan, we need to describe the work plan for the 1 year, as well as the cost networking tools that we would plan to use and spend the funds on. And so to give you an idea, these are the 4 Cost Innovators Grants that were funded in the last round, from the last round of cost actions that were invited to submit an Innovators Grant. So the first grant here, actually, it's not too clear to me exactly what they're proposing, but the second, third, and fourth awards here all seem to relate to things to do with software, for example. This one is software for kidney exchange programs. The third grant relates to building a database of biomaterials, and the fourth one relates to an open access repository of stem cells for patients. So this kind of gives us a bit of a framework or a bit of an idea of the type of grants that they might be looking for. If we reflect back again on the European birth cohorts coordination, you can see again, following the network building and inventory building, the amount of effort that was put into developing the central database and developing the harmonized database and fair infrastructure. And so our idea, what we would like to discuss with you today, and also in relation to the EBFOR project, where we are starting to develop some of this infrastructure for a small number of cohorts in some countries, would be to possibly expand this effort along the lines of the birth cohorts, approach. And so here we could propose something like, taking the inventory of cohorts that we've already built, but taking that to the next level and developing an online variable data catalog like the one we showed. developing harmonization protocols to actually give a framework to harmonize the data in the cohorts, putting efforts towards developing and training people on how to apply and how to use federated analysis infrastructures, as well as developing a research strategy for the cohorts as well. So the impact could be something like these online resources are developed, the cohort variables are cataloged and harmonized, and people are trained in using this type of infrastructure, leading ultimately to more definitive studies and more efficient collaboration in occupation and health. And in terms of spending the money could be spent for things like holding one meeting of cohorts to discuss the development of all of this infrastructure and tools, and possibly holding a training school on conducting federated analysis, as well as funding as many STSMs as possible to have researchers travel to visit other research centers and other cohorts to actually implement, the harmonization protocols and actually conduct some federated and pooled analysis. So that was kind of our main idea, to focus on developing the infrastructure for conducting pooled studies as much as possible, developing kind of a complementary effort here to EPFOR and building directly on OmegaNet here. But we're very happy for all of your ideas and comments. So maybe I'll stop now and maybe turn it over to Ingrid and turn it over to all of the other management committee members. I'm sure that many of you have other ideas and thoughts, and we'd love to hear your ideas here.
Thank you so much.